26-year-old woman has 12 hours of left eyelid tenderness and redness following 3 days of mild tearing and swelling discomfort. She has acne rosacea, managed with topical brimonidine gel, and smokes 10 cigarettes per day for 8 years. Her temperature is 37.8 degrees Celsius, pulse 96 beats per minute, and blood pressure 124/86. There is significant left eyelid erythema with mildly injected conjunctiva, and visual acuity is 6 and 6 in the Snellen eye chart. Examination of the eye 3 days ago is shown in Figure 17. Which complication has most likely developed? A. Blepharitis, B. Chalazion, C. Dacrocystitis, D. Infective conjunctivitis, or E. Periorbital cellulitis. The correct answer for question 6 is E. Periorbital cellulitis. We can see in Figure 17 an example of an upper eyelid stye, which predisposed this patient to developing periorbital cellulitis as a complication. A hordeolum, commonly known as a stye, is a localized infection of the eyelid, most often caused by a Staphylococcus bacteria. There are 2 types of styes. External styes occur at the base of the iris follicle and involve infection of the gland of Zeiss or mole. In contrast, internal styes develop within the tarsal plate of the eyelid, affecting the meibomian glands. Several risk factors predispose individuals to hordeolum formation. These include chronic blepharitis, poor eyelid hygiene, acne rosacea, hypercholesterolemia, and immunosuppression, such as in diabetes mellitus. Clinically, hordeolum presents as a tender, inflamed swelling at the eyelid margin, often accompanied by tearing and localized redness. We can see in Figure 18 differentials of a stye. Part A shows a chalazion, and Part B demonstrates a stye associated with a particular follicle. Management of a stye primarily involves conservative treatment. The first-line approach includes applying a warm compress to the closed eyelid for 5 to 10 minutes, 2 to 4 times daily, until resolution. Patients should also be advised to avoid contact lenses and refrain from using eye makeup to prevent further irritation or infection. For painful styes, plucking the affected eyelash may help drain the infected follicle. In some cases, incision and drainage using a fine sterile needle may be necessary. Although most styes resolve without complications, some cases can lead to more serious conditions. Periorbital cellulitis may develop presenting with swelling, redness, and eyelid tenderness, but importantly, it does not affect vision. However, progression to orbital cellulitis is more concerning. This can cause acute eyelid swelling, a red and painful eye, blurred or doubled vision, painful eye movements, headache, fever, and malaise, requiring urgent intervention such as a CT head and intravenous antibiotics. Other possible complications include the formation of a meibomian cyst from a persistent internal stye and secondary infective conjunctivitis.